Good day, everyone. We present to you a case study report of an 8-year-old female patient diagnosed with dengue fever and low thrombocytes. In partial fulfillment of the subject MLS 050 from the Department of Medical Technology, presented by Group 4, Cyril Nicole Bisogna, Francesca Ivy Buensalida, Hannah May Canizares, Shara Isabel Hansen, and Tricia May Ligay. This case study contains the following agenda: abstract, case background, components examined in lab tests, results and interpretation, and the lessons learned about the importance of HIS when presenting lab results. Dengue fever is a viral infection spread to humans by infected mosquito bites. Dengue causes a wide range of diseases. It can range from subclinical disease, where people are unaware that they are infected, to severe flu-like symptoms in those infected. Dengue has distinct epidemiological patterns associated with the virus' four serotypes. Within a region, this can co-circulate, and many countries are hyperendemic for all four serotypes. In this study, we present a case of an 8-year-old female patient with high-grade fever varying from 39 degrees Celsius to 40 degrees Celsius for 5 days, headache, periorbital pain in the eyes, joint pains, body malaise, loss of appetite, persistent vomiting with nausea, and noticeable petechial rash on the posterior part of her upper and lower extremities. Upon further investigation, the patient was diagnosed with dengue fever, possibly hemorrhagic fever. Because of the need to strengthen management and clinical practices, this study is relevant for medical practitioners and medical technologists. Furthermore, developing strategies to increase medical technologist awareness and reporting requirements for these cases.
Let us talk about the background of this study. Dengue fever is spreading rapidly over the world. The dengue territory is inhabited to over 50% of the world's population. Despite its prevalence in the tropical regions, indigenous dengue occurrences have lately been identified throughout all the continents but apart from Europe. Dengue fever is currently the most significant arbovirus illness of humans. Dengue is spread by the mosquitoes Aedes aegypti and Aedes albopictus that are present worldwide and are prevalent in more than 100 countries, including Africa, Asia, Pacific area, South America, as well as the Caribbean region. The mosquito will initially receive the infection by feeding on an infected person, whereas the infection level present in the blood is strong or high. This frequently occurs before the host symptoms start. The virus must replenish upon a blood meal for 8 to 12 days until it may be transmitted to a new host. Since the mosquito stays infected for the entirety of its life, it has the potential to transfer the virus countless times. In certain circumstances, human-to-human exposures have happened through actual blood interactions, such as organ transplant, transfusion, and placental blood exchange. After being infected, initial symptoms begin to appear. Often, the symptoms are flu-like. The picture shows the symptoms of dengue fever, which are severe headaches, muscular pain, joint pain, nausea, vomiting, eye pain are the common complaints. A high fever is characterized by a high body temperature, which is 40 degrees Celsius or 104 degrees Fahrenheit. People with weaker immune system who are susceptible to severe infection or subsequent infections are at greater risk of acquiring dengue hemorrhagic fever, a severe form of disease. considering blood and fluid leakage is a primary problem, and sustaining enough correct body fluid level is pretty important. There have been recently no medications that increase immunological memory accessible in the treatment of dengue fever. The most effective approach of treatment is prevention, which entails limiting contact with mosquitoes and managing the population of the mosquitoes. Screens should be installed on all windows and doors. Repellents should be applied both indoors and outdoors. Waste must be disposed of correctly, and clothing should cover a large portion of skin as much as possible. Containers that can truly contain standing water must also be cleaned regularly. And efforts should also be made to avoid mosquito bites when in the presence of someone infected with the virus. Early identification and treatment can also be dramatically reduce the risk of subsequent problems and death. The components examined in laboratory tests that are requested in this case are complete blood count, bleeding and clotting time, blood typing, urinalysis, and NS1 antigen and antibody. First is the complete blood count. A complete blood count is a blood test used to assess a person's general health and find a number of illness such as anemia and dengue. A complete blood count must be conducted to differentiate and confirm diagnosis. And here is the reference range for complete blood count. Complete blood count has blood components, and these are white blood cells, red blood cells, hemoglobin, hematocrit, MCV, MCH, MCHC, and platelets. And on the right side are the reference range for both male and female.
Blood typing is a method to tell what type of blood you have. ABO blood group system is a classification of human blood based on the inherited properties of red blood cells or their erythrocytes, as determined by the presence or absence of the antigens A and B, which are carried on the surface of the red cells. Persons may thus have type A, type B, type O, or type AB blood. The ABO blood group plays a considerable role in making a person susceptible or resistant to diseases such as malaria, cholera, Helicobacter pylori, and chikungunya infections. It has been described that individuals with different ABO blood groups differ in their susceptibility or resistance to viral and bacterial infections and diseases.
The dengue NS1 antigen and antibody detects both dengue virus and NS1 antigen and antibodies to dengue virus. Dengue LGM and LGG are also detected. IgM means the first antibody produced by the immune system when a virus attacks, while IgG means exposure to the dengue virus in the past. NS1 tests have been developed for use in human serum, plasma, and whole blood. Because dengue NS1 antigen and antibody has easier performance, sensitivity, and low cost, it is considered as the most useful in detecting dengue virus.
Urinalysis, or the urine test, involves the checking of appearance, concentration, and content of a urine. It helps in detecting or managing wide range of diseases or illnesses. For example, the urinary tract infection can make our urine look cloudy instead of clear. For our situation, our patient experienced vomiting, which means that she is losing fluids from her body, which can lead to dehydration. Urinalysis is very crucial for this case since we can detect whether our patient is hydrated or dehydrated. And it can also tell us whether there are abnormalities in her urine.
Moving on its bleeding and clotting time, it is a test that quantifies how long it takes your blood to clot and to stop bleeding, that also creates a small shallow cuts in your skin. For our personal understanding, there is a significant risk of bleeding during a crucial stage of dengue. This results to associations of coagulation test or bleeding and clotting time must be performed. This is to determine whether you have any problems of your clotting factors that results into little or too much blood clotting.
The 8-year-old pupil was medically diagnosed with dengue fever after experiencing symptoms such as headache, periorbital pain in the eyes, joint pains, and body malaise. After conducting the required laboratory tests, which are the complete blood count, blood typing, bleeding and clotting time, dengue NS1 antigen and antibody, and urinalysis, we have arrived with the following findings. First is the patient's complete blood count. It showed that her white blood cells and platelets are in below normal range, while her hemoglobin, hematocrit, MCV, MCH, and MCHC, as well as her red blood cells are normal. The table showed that her white blood cells is 2.5, red blood cells 4.23, hemoglobin 11.5, hematocrit 35.2 rather, MCV 84.5, MCH 28.6, MCHC 34.6, and her platelets.
The blood typing test results revealed that anti-A and anti-B were only partially covered, whereas anti-D and control were completely covered. Based on this information, the patient has a blood type AB negative.
Patient's dengue NS1 antigen, IgM, and IgG results are all positive. The normal range for IgG is 1.64 or less, the same as reference range of IgM, which is also 1.64 or less. Her IgM result is 2.86 and IgG result is 2.78. The patient's results exceeds the normal reference range. A positive dengue NS1 antigen, IgM, and IgG indicate prior infection, but it doesn't mean that a negative dengue NS1 antigen means out of infection.
The laboratory test results for urinalysis shows that the color of her urine is dark yellow. This indicates that she is dehydrated. Dehydration is common if a person is having a dengue fever as consequence of high fever, anorexia, nausea, vomiting, and diarrhea during the febrile stage of 4 to 6 days.
As can be seen from the bleeding and clotting time laboratory test, it shows that the patient's prothrombin time or PT result shows abnormal since it exceeded the normal rate, which is 10 to 13 seconds, while her activated partial thromboplastin or APPT result shows normal since it has a 25 seconds normal rate. Generally speaking, these were used to determine if there are coagulation abnormalities, and as a result, it appears that there could be a higher chance of activated partial thromboplastin or APPT result being abnormal if the patient wasn't diagnosed immediately after her 5 days fever.
Keeping various types of data at every institution is a time-consuming undertaking. It is crucial for physicians, nurses, and other healthcare work groups to have a juncture on patients' medical information to assist them to create better judgments in treating and diagnosing the patient, especially in the healthcare business where various patients have distinct medical demands. As a result, hospital information system makes it easier for medical personnel to manage each patient's data. Furthermore, utilizing information technology to provide great healthcare to patients demonstrate how much potential we have as we continue to be creative and imaginative in making things run more.
Technological advancement has brought about progression in every sector, ensuring that the system meets more efficient and effective in serving more people worldwide. The healthcare industry is no different. The field of healthcare informatics has benefited from technological advancement. The Health Information System, or the HIS, is an innovation in the health industry, allowing for efficient management. The implementation of this system aids in improving the quality of patient care, lowering operational costs, eliminating errors in administration data, and organizing the entire internal management process. I believe that information truly saves lives. Healthcare administrators, doctors, and nurses who have access to patient and population health data can make critical care decisions that can make or break their patients' lives. Getting health data into the hands of the right people as quickly as possible depends on health information systems that seamlessly and intelligently integrate healthcare and information technology.
To sum up everything of what I have learned, health information system plays a vital role for safekeeping of all patients' data and records, and this has really improved our healthcare services, as its purpose is to make it possible for decision makers across the board to use accurate and timely data. Thus, the accuracy of the data gathered is crucial for a well-functioning health information system.
The introduction of HIS aids in enhancing patient care quality, decreasing operating costs, eliminating errors in the administrative data, streamlining the entire internal management process, and of course in presenting lab results. HIS is really crucial since the results of the laboratory tests directly impact the medical decision making, contributing to the diagnosis and treatment of the patient. This could help the doctor save time in diagnosing medical issues or conditions because they wouldn't need to wait for the nurse or other employee to deliver the results they needed to them directly. They could just simply access this system and find the results that they needed.
Health information system collects data and compile it in a way that can be used to make healthcare decisions. Cost control by using digital network to exchange healthcare data creates efficiencies and cost savings. In population health management, health information system can aggregate patients' data, analyze it, and identify trends and populations. Using health information systems to increase convenience and access for patients.